from Louisiana's home team. This is Fox 8 Morning Edition at 6 a.m.
Thanks so much, Nicandra. Time now 7:24. If you take proper precautions, you can prevent lung disease. And Dr. Russell C. Klein with People's Health joins me now with more on chronic obstructive pulmonary disease. And thank you so much, doctor, for joining us this morning.
My pleasure.
And that's kind of like the long name for what people really know as COPD.
COPD.
And what, for somebody who does have this disease, what happens to the body?
Well, COPD is made up of two things. Chronic bronchitis, which is inflammation of the airways, and emphysema, which is destruction of the little air sacs at the end of the airways where we exchange oxygen and carbon dioxide.
Who's most at risk for this disease?
Smokers. 85 to 90% of people who have COPD are present or former smokers.
Are there people out there who may be exposed to this disease who have not smoked?
Well, you can get it from secondhand smoke. You can get it from some kinds of industrial air pollution. And then the other thing, very occasionally, there are congenital problems that lead to it.
And I know I've heard of people who've had emphysema or chronic bronchitis, and it's not fun to deal with when you talk about something that's obstructing how you breathe. And
right.
It could be really painful and a struggle and you know, harmful to the body. What types of treatments are out there for this right now?
There are a number of things. I mean, the single most important thing that you can do is to stop smoking if you're smoking. Then there are a number of treatments, mostly inhalation treatments, which will get rid of or damp down the inflammatory reaction, help you to clear the mucus out of your lungs. And there are antibiotics if you get an infection. And then there are things that you can do for rehabilitation to help you breathe better. And then very, very occasionally, surgery will be helpful.
So really no cure out there?
There is no cure. Once you have COPD, you have COPD. But you can make it better. You can make your life better. You can make your life longer. And you can do more. There's a lot that you can do. And the single most important thing that you can do if you smoke is to quit smoking. And there's a lot of things available to help you with smoking cessation.
And I know that you want to mention, you all at People's Health have a series of overviews, presentations where you really try to get this information out.
Right. We talk to groups of people with COPD on an informal basis. People can ask questions and get all of their questions answered and then take advantage of all of the things that People's Health offers to make them better.
And I know the next overview series coming up on COPD, April 23rd, next Wednesday at St. Charles Parish Hospital. That's at 11 a.m. You have to reserve, though. Make your reservation by tomorrow, the 19th. Dr. Russell Klein, thank you so much.
My pleasure for being here.
All right, some good information.